Jai Shri Krishna. So I'm going to show you my lab rat that I do most of my experiments on. So here is our lab rat. This is the ear, face, anterior surface, lateral surface. Why are you laughing? Posterior surface and the other lateral surface. So this is the rat, this is the ear, this is the helix, this is the antihelix, this is the crura of the antihelix, and this is the triangular scaphoid fossa, and this is the external auditory meatus, and here is the conchate, and here is the lobule. Oh, basic anatomical mistake. This is not a rat. Jairam, so now I should explain the middle ear cavity or the tympanic cavity, and we explained the external ear as shown here, the pinna, the auricle and the external auditory meatus. So now we should see the middle ear cavity relating these two. For a small recap of the external ear, the pinna is supplied by various nerves and drained by lymph nodes, and half of it is fibrocartilaginous tissue, whereas the other part is a lobule, and we have a few muscles that have no value in it, and we have a few nerves, and then we have the external auditory meatus. It has 1/3 cartilaginous part and 2/3 of bony part, and you can watch the complete video for this. And next we have blood supply of it. There are 3 different arteries present, and we have veins that follow the arteries. We have nerves like auriculotemporal nerve and the auricular branch of the vagus nerve, and we have the very complicated tympanic membrane or the eardrum, and we have the complete information about it explained in the previous video. We have also explained margingotomy or cutting the tympanic membrane. Today, in the video we're going to do now, that is the middle ear cavity. We shall see the information regarding it, and this is a very complex part of the ear, and this is a more detailed video than the previous one. So it is basically a cuboidal type of shape. So I should make another video with a comprehensive study of all these 3 in one image: lateral view, inferior view and posterior view, and anterior view and superior view also. So it's a cube compressed from side to side, somewhat laterally medial. So we have it somewhat like this. It's a compressed cube-like space. It's a cuboidal space, and it's a narrow slit-like small air-filled cavity, and it generally doesn't communicate with outer parts because the tympanic membrane is completely covered it from the lateral side, whereas we have the wall over there which has completely covered it, and the next part is only the cranium and the mastoid process to the adytus and antrum. So basically there is not much opening in this area, except that we have been provided by God with a pharyngeotympanic tube that connects the pharynx or the throat with the tympanic membrane. So the lateral wall is removed, and just a small image of how it would look. So this is somewhat slant, okay? So we have a slant type of bone over here, and the measurements are vertical diameter is 15 millimeters, and anterior-posterior diameter is 15 millimeters. So it is actually an exact cube almost. The transverse diameter is roof is 6 mm, the center is 2 mm, this point, at floor it's 4 mm. So the communications of it is nasopharynx. So nasopharynx means the nose and the pharynx, the throat. So these two are connected to each other, and it is collectively referred to as the nasopharynx. And the nasopharynx is connected to the middle ear by a pharyngeotympanic tube. It also has a bony part and a tissue part, a connective tissue part. Posteriorly with time, now we have another connection to this middle ear cavity. We have it through the pharyngeotympanic tube, that is medially downwards and forwards. That is the nasopharynx position from the middle ear cavity. And the tympanic antrum, or we call it the mastoid process of the temporal bone, it has mastoid air cells, and that is connected to by a round entrance point called adytus and antrum. It leads towards the mastoid antrum, and that is from the posterior wall. Actually it's the medially posterior wall of the middle ear cavity that connects to the mastoid antrum, and these are the communications of the middle ear. The contents in the middle ear are 3 ear ossicles. You can see them here. I shall give a detailed explanation of these 3 small bones. They are the smallest bones in the body, and especially the stapes is the smallest bone. So these are joint connected to each other, and I shall explain these also. They are called ear ossicles, tiny bones. So the 2 muscles, the tensor tympani muscle and the stapedius. The stapedius pulls and handles the stapes, the smallest bone, and the tensor tympani has a variety of functions like pulling the, being connected to the malleus, and it also has another function that is making the tympanic membrane taut, making it taut. So there are 2 nerves, 2 main nerves that pass through this middle ear cavity. The cauda tympani nerve, that is a branch of the facial nerve that also passes here, and the tympanic plexus that surrounds the internal carotid artery. The internal carotid artery is present somewhere exactly on the anteriorly lateral portion of the tympanic cavity. So we have it over there with the sympathetic tympanic plexus surrounding it, which supplies the middle ear cavity. And vessels supplying and draining the middle ear are also present. There are various blood vessels. They are present draining and supplying the middle ear. And the boundaries are the roof. So the roof boundary is created by a tiny bony sheath. It's just created by a very tiny bony sheath. Thin. It's called tegment tympani. And we have the floor, a thin bony plate of petrous temporal bone. We learned that the temporal bone lodges the external auditory meatus and also the middle ear cavity. So the petrous temporal bone is the floor of the middle ear. And on the floor we have the internal jugular vein. It just passes over like this. We have a small bulb. It is directed superiorly, and it is seen when you see through when we see anatomy of the middle ear cavity. We see a small bulb there. It's a very large vein. It's called the internal jugular vein. It has the bulb over here, and the anterior wall has a semi-canal for tensor tympani. So we have the tensor tympani coming with its canal. It has a semi-canal which surrounds it, which lodges it, and that comes through and then it hooks through various portions and it performs various functions. Now next we have the pharyngotympanic tube that is also present in the anterior wall. So the pharyngotympanic tube is connected to the anterior wall. It goes forwards, downwards and medially. So if you can follow the action of the hand, this is in the anterior wall, the front portion. So it is like from here forwards, downwards and medially. That reaches the nasopharynx. And now we have the internal carotid artery, and there are the sympathetic plexus surrounding this, and that supplies most of the middle ear. And next we have the mastoid antrum and the adytus at antrum also over there. Just opposite to this. So directly opposite to this. So this adytus at antrum is present in the posteriorly medial portion of the middle ear cavity. And I shall explain this complete thing through this image over here. And these are the 3 ear ossicles that we're going to study now. The 3 ear ossicles, okay, let's see this later. First let's do this portion. So we're talking about the middle ear cavity. This is how it looks, but we remove the lateral wall over here. So you know that there are 6 different surfaces, down, up, like that of a cube. So we have removed the lateral wall to understand the internal portions. The lateral wall is actually the medial surface of the tympanic membrane. Medial is towards the body. So this side is the lateral wall. And we have the facial nerve passing through this point over here. There's an opening over here in the floor, in exactly the posteriorly lateral inferior floor of the middle ear cavity. of the tympanic cavity, and the facial nerve passes through this, and it has a few branches over here. The chorda tympani nerve is present, and we also have the greater petrosal nerve and the lesser petrosal nerve coming through this area. We have the glossopharyngeal nerve, the tympanic branch of the 9th cranial nerve, which is called the glossopharyngeal nerve. So we have many cranial nerves, and the 9th of them is called the glossopharyngeal nerve, and this supplies the middle ear cavity and also goes through this portion. Now I shall explain this jugular vein. We have the superior bulb that is reflected on the inferior floor of the middle ear cavity, and we have the internal carotid artery that's surrounded by, surrounded by the sympathetic plexus that has different nerves that supply this portion. We have the pharyngeal tympanic tube. You can come forward, Abhigya. We have the pharyngeal tympanic tube over here. This supplies, actually this connects the middle ear to the nasopharynx, which I explained right now. The tegment tympani in its semicanal also connects through the anterior wall itself, and we have the central portion called the promontory. When we study the internal ear, we should understand more about the promontory. So the promontory is a basal coil of the cochlea. So cochlea is this thing over here, and I shall explain this in the next video. So this is this, and this is the basal coil, means the down part, the inferior part of the coil that is reflected over here. And we have a round window over here. It's called fenestra cochleae, and that also corresponds to the cochlea in the internal ear. We also have another fenestra vestibuli window over here, which is covered by the stapes. That is slightly down, but I've just marked it a little bit up. And we have the anitus and antrum over here. I explained that also right now. And we have the nerves going through this area, and there are other nerves that pass through the middle ear. It's called the carotico. We have a few more nerves over there. The nerve supply is inferior carotico-tympanic nerves. We have them. They actually surround. They are the sympathetic plexus, and the tympanic branch of the glossopharyngeal nerve also supplies the middle ear. And the medical significance and applied anatomy we shall discuss later. Let's come back to the ear ossicles and the muscles of the ear. So there are 3 ear ossicles: malleus, incus and stapes. So malleus has a head, it has a handle, lateral process and an anterior process, and an anterior limb. So it has a lateral process, an anterior process, and the head and a handle, a small handle. It's a long handle compared to this bone, other parts. And we have the incus, which has a body, a short limb and a long limb, and a portion that connects to the malleus. You can see this connection over here. And we have the stapes. Can you come a little forward here? We have the stapes. The stapes has head. The head is a small piece. The stapes resembles a stirrup. You might know about the horse stirrup that we wear. So it's the same thing here. The head connects to the long limb, the long limb of the incus, and the stapes has a small opening here and it has a base, a circular base. This base actually blocks the fenestra vestibuli that opens into the internal ear and the cochlea. So this is a very intimate connection between the whole of the ear, and this base is also a very important portion anatomically. And the anterior limb is here. So actually, if you're supposed to see the exact position of this, you have to turn this whole thing somewhat this way, and the anterior process would come turning forward. The lateral process would, be somewhere around the right angle, pointing laterally, and this would be the exact position of the ear ossicles. And next we have the incus. So we have to just turn this way, the other way around, which would give the exact position. And they're somewhat slant also. Somewhat anteriorly slant. The muscles present here are tensor tympani and the stapedius. So tensor tympani muscle, it makes a tympanic membrane taut, and the stapedius pulls the stapes laterally. So when it does this action of making it taut like this, then pulling this way and pulling this way, this exerts a dampening effect on noise. So suddenly you get large sound over blasting sound. Then the ear does this action. This is involuntary. pulls it together, and you are not that much affected, though you are affected. So it exerts a dampening effect on sound that can protect the whole of the ear. And now we should discuss the medical significance and applied anatomy of the tympanic cavity. So sometimes there are infections. Can you go behind over there? Sometimes there are infections in the middle ear cavity, and this can actually spread to the mastoid antrum or the mastoid process, to the mastoid air cells, and from there it can also spread to the sigmoid sinus and the cerebellum. So this can be quite dangerous, and that's why they solve it quite quickly. It's supposed to be done quite quickly. And then we have in small children, they have upper respiratory tract infections. That is from the pharynx, the nasopharynx, and some upper parts of the respiratory system. And we have infections there. They can easily pass to the middle ear cavity via the eustachian tube, because that's more, it's more easier, it's more horizontal, and it's more easier to pass through instead of going through the pharyngotympanic tube. So why do we get pain when we travel by an aeroplane, and aeroplane, gets high ascent? So when we are climbing up a mountain with a vehicle, or we are traveling in an aeroplane and we reach heights just at the beginning of the ascension, why do we get pain? This is a very important question. The reason why is that I have explained that the middle ear cavity is completely shut from the external ear. So the external ear has a different atmospheric pressure that corresponds to the atmospheric pressure of the surrounding area, and the middle ear cavity doesn't have the same atmospheric pressure. It has a different type. It has the same type that was previously made, and the whole of the body has a different atmospheric pressure because it is open almost, and only this portion is shut. So what happens? The atmospheric pressure is more inside and less outside, and the tympanic membrane is pushed out. So when it's pushed out, it pops out, they get pain, a lot of pain. And the pain in descent is more. So how do we solve this pain? Keep swallowing. So what do we do when so how swallowing makes the atmospheric pressure the same? The reason why is the pharyngotympanic tube is slit-like and opens only when we swallow something or we yawn. So it gets opened at that time, and when it gets opened, the atmospheric pressure, the air is released, the different pressure air is released from there, enters the nasopharynx and equalizes the pressure. But when it's in descension, or the plane comes down, or we're descending a mountain with a different atmospheric pressure, well, it's different because we can't suck through the pharyngotympanic. Maybe we can bring it down, but sucking is quite difficult. And that's very difficult for people who have common cold. So when they have common cold, it's very difficult to swallow. And when we swallow, we can't, manage. And when we have pain in the throat, we can't swallow. So the pain is more. That's why it is advised not to travel too much, otherwise it pains a lot. And these are the medical significance and applied anatomy of the middle ear cavity. And we shall also study the internal ear in the next video. So thank you. Jai Shri Krishna. Jai Ram. Jai Shri Lakshmi.